obviously the temporal points are technically far more challenging, so lots of doctors will avoid doing those. In terms of your micro irregularity that you bring to a hairline, which I've seen obviously on your patients now, just tell us a little bit how you go about choosing some of those finest hairs for the hairline.
You're segueing me off temporal points, but I'm going to stay on temporal points just for one more minute because they're a real challenge. And you're quite right. I'll come on to the hairline, but with a temporal point, you do use predominantly singles. I find it works best if you use very fine caliber single hairs. And the trick is to make the exit angle of the hair very, very acute. So almost sort of, as flush as you can get to the...
How you make the incisions is very different, and how the hair grows. Often with the hairline, the hair tends to go about 45 degrees forward, and with the temporal points, they tend to go backwards. So
and the micro irregularity is different as well, because a good hair surgeon will know how to make a hairline irregularly irregular, so it's sort of truly scattered like the edge of a scatter diagram. With temporal points, I think you need a little bit more crispness, a little bit more regularity, because if you did the same level of irregularity along the temporal point, it looks a bit of a mess, and the human brain is sort of hardwired to look for discrepancies between left and right. And what you might think is natural irregularity is interpreted by the viewer as asymmetry, which it really bugs people. So what makes the temporal points look natural is using very, very fine single haired grafts, putting it in at the right angle, the hair at the right rotation, so that you don't get this kind of sproutiness. If you bear in mind that every hair has a very slight curl to it, you don't want it curling outwards, you want it kind of going in